Welcome back, everyone. Well, what if you had a devastating, deadly disease that ran in your family? Would you want to use technology, if you could, to prevent a child from getting it? The New York Times just profiled a couple where the woman was going to die someday from a rare brain disorder. She still wanted a family, so she used what's called pre-implantation genetic diagnosis to avoid passing this on to her babies. Now, parents at the Center for Advanced Reproductive Services at UConn are using this technology to better their chances of having a healthy baby. And I sat down with the director of the in vitro fertilization lab at the center in Farmington to learn more about this. For many trying to have a family here at the Center for Advanced Reproductive Services at the UConn Health Center, their hopes and dreams are stored here in thousands of embryos. New technology now allows a couple to screen those embryos before they're implanted in the mother to look for genetic or chromosomal disorders.
If we are able to identify normal embryos and implant those, the chances of getting pregnant are better.
Dr. Claudio Benadiva says pre-implantation genetic diagnosis offers couples who may carry the gene for a devastating disease peace of mind. This is sort of like an amnio, but it's for the embryo.
Exactly, except that, you know, obviously the pregnancy hasn't happened yet.
Right.
So you don't have to be facing those difficult decisions when an amniocentesis results are abnormal. You know, you're already pregnant and unfortunately pre-advanced pregnancy. So it's a lot easier and I think ethically and morally much more acceptable.
Which diseases can you screen for?
Any genetic disorder for which there is genetic testing available. That includes cystic fibrosis, muscular dystrophy, Huntington's disease, Tay-Sachs. There are hundreds of genetic disorders.
PGD will also detect chromosomal abnormalities in embryos, which are more common as women get older.
Especially as women get older, a lot of those embryos that look beautiful, they're not normal. They don't have the normal number of chromosomes. They have an extra chromosome, they're missing one, and either they will never implant, or they will miscarry, or even worse, they can result in a baby affected by a chromosomal disorder like Down syndrome.
For couples who have struggled with miscarriages, PGD can offer hope.
We found that when we use PGD, especially for the chromosomes to look for the normal chromosomes in the embryo, the chances that that embryo will implant and that will make a healthy baby are higher.
This video shows how it works. A biopsy of the embryo removes one cell, which reveals the genetic makeup of the entire embryo. The process doesn't hurt the embryo, and within a couple of days, test results will show if the embryos are healthy. Knowing they're healthy means doctors can implant fewer of them, reducing the chance of multiples. For couples already investing thousands of dollars, PGD can save them money and heartache in the long run, since a healthy embryo has a better chance of becoming a healthy baby. Though some worry this technology will be used to design the perfect baby. So far, Dr. Benadiva says that's not realistic.
In order to test, the gene for the disease has to be identified. For example, you know, a lot of people ask, well, diabetes, can you test for diabetes? There is no one gene for diabetes, so we cannot test for that. Some people question, well, is this like a slippery slope? Are you going to test for intelligence or beauty? There is no gene that's been identified for that.
Well, recent study shows only about 6% of doctors have even ever mentioned pre-implantation genetic diagnosis to patients. Only 7% said they felt qualified to answer questions about it. So the good news is the doctors at the Center for Advanced Reproductive Services right at UConn are experts on the latest treatments available, and they offer frequent seminars on the options. We have a link to the center on betterct.com. A lot of those seminars are coming up, and they are free. Scott?
All right.